Shalom, everybody. Hope you're doing well. Today's question and answer Thursday. So I've got a one for you, and it says, when do you think that a person should consider themselves being ready for psychedelics, and specifically psilocybin, in order to get some inner clarity on what's going on? And when should they not do it? So let's go with the when should you not do it. That seems to be easier. If you have a diagnosis of bipolar, schizophrenia, psychosis, any of the diagnosis where you are on an antipsychotic medication, then psychedelics should be something that should be, I would say, avoided. It's contraindicated on many cases. I'm not saying that that is always, so I would say work with your doctor, your psychiatrist, and see whether or not that can be something that's beneficial for you. But when should you not do it? I would say anytime you're on anything that is a antipsychotic, that is definitely a clear indication that you should be reserved in using psychedelic meds. When it comes to psilocybin, I would also say this: psilocybin is legal in some areas, not legal in others. So if it's legal in your area, then I would say, in your part of the world, then I would say, it's something that could be considered. Some people do find it to be a drug that can be very opening and very, I don't know if I would say clarifying. The medicine that I've seen to be most clarifying, and it happens to be the one that I use, but I see that a lot of times ketamine can be one that is, it brings a lot of clarity to people, brings a lot of perspective to people. And so that one I can speak for. I have not worked myself with psilocybin, so I can't say as much to it. But when should a person consider themselves ready for psychedelics in general? I think that there's a couple different things that I have in mind. Number one, in Israel, the three different things that a person is diagnosed with when they can receive ketamine-assisted psychotherapy is treatment-resistant depression. That means you've tried like SSRIs or things like that, at least 2 of them, and they weren't, beneficial for you. There is suicidal ideation or suicidality, i.e. the person has been maybe hospitalized, or suicidality is something that is frequently with them. That's the second one. So treatment-resistant depression, suicidality, and PTSD, post-traumatic stress disorder. If you have any of those diagnoses, then psychedelics might be a benefit to you. There's many studies going on with maps that can kind of help you to understand whether or not psilocybin or MDMA might be of benefit for you. And then there are other different studies with ketamine-assisted psychotherapy. Andrew Huberman has a podcast where he talks a lot about the different medicines. And so I would say do a lot of research. And when is a person ready? I think when they've tried a lot of other things and they haven't been successful for them. So then maybe it's time for them to look into something that's a little bit alternative. I've seen it be really wonderful for some, and I've seen it being really horrible for others. And so I would say proceed with caution. Like I would say with anything, proceed with caution. And it could be a really beneficial, great thing. And make sure you do it in the right environment. I would say if there's anything that I would say, that's the biggest piece. Do it in the right environment, the right set and setting, somebody who you can trust. Because there's a lot of people doing these things on the underground, and a lot of people who are really getting injured and damaged because of doing it on the underground. Now, there are other underground clinicians that are absolutely amazing. And I've met some of them. I think they are phenomenal people and phenomenal clinicians. And at the same time, there are others that are not, and they're really dangerous. I would say dangerous people. And so you have to really be careful and see that you are in a place where you feel safe, where there is a lot of safety, where the set and setting is good. And these are some of the things that I would say really keep in mind before a person considers themselves ready to go into psychedelics. So I hope that's beneficial for you. Maybe it's at least a start. And if you have further questions, you can always put them into the chat. Hope you have a beautiful day. Take care of yourselves and take care of others.